they can buy good health by doing more scans, more blood tests will equal better healthcare. And this is the unique thing about healthcare. People on the low end of the healthcare spectrum, meaning they don't have access because of financial limitations, they get bad healthcare. Why? Because they can't afford the car to get to the doctor's office. They don't have insurance to get seen by the doctor. They can't afford their medications, so they get less quality care. But then the wealthiest also get bad care because they think it's Burger King, that they could just get more, and that's somehow
whatever
keep
they
them,
want.
yeah, and that would keep them healthier. But there's actually a syndrome known as VIP syndrome in healthcare, where
VIP syndrome.
yeah, where like you think you're very important, and because of that, you're going to get more care. It can lead to downstream effects of not only getting care that you don't need, but also side effects that are sometimes lethal because you pressured your doctor because you're so important.
Here we go, at the top of the class on a roll.
Ladies and gentlemen, welcome to another episode of The Crown Prince of Brooklyn. I am extremely honored to have one of my best friends here, who is not only a doctor, he's a pro fighter, a model, a comedian, an actor, activist, could possibly be at the White House one day because of all his associations. Let's give a big round of applause for a very special guest, Dr. Michael Warshawski.
Wow, I'm entering the White House. Let's do it.
You are a man of many hats. Mm-hmm. How did you get started on the journey of medicine?
Yeah, so medicine for me started up when I was finishing up high school, and I actually got to watch my dad do the whole journey of medical school and residency in his 40s. Most kids are not of age to know what their parents are doing. But with my father's situation, because he had to redo medical school and residency here in the United States, I got to see that whole journey, and I fell in love with the field. I said, I want to be a doctor.
Right.
I want to take care of patients. I want the same relationship he has. And to be honest, I wasn't a student that paid attention well, except in science. I was excited about it. I wanted to learn more about it. And I feel like when passion meets skill, that's when you get a really good balance.
So I think that's something that you and I have in common. You know, my parents are both in the dental world. I got to witness them at a young age going to dentistry, going through dentistry, learning about dentistry, building their practice. And that's part of the DNA, whether we like it or not. Like, we have that in us. So tell us a little bit more about like growing up, with a father who's a doctor. What were some of the lessons he taught you, or what were some things that you kind of picked up from him?
Well, uniquely, my father was always saying, don't go into medicine, because being an immigrant, you're always worried about your kid's financial success. And what my father was seeing in the field was that it was becoming very messy. It was becoming problematic within reimbursements, getting paid from insurance companies. Right. And he was saying, like, look, if you're looking for financial stability and really big financial success, medicine isn't that for you. But I started seeing the value in what he was doing past the financial success. And I viewed an opportunity where if I was going to be really good at my job as a family medicine doctor, I could then have financial success in other avenues of life. So that was an important lesson he put out.
So when you told your father, I'm interested in going to medicine, after he said, I don't think you should go into medicine, what was his feedback?
His feedback was very straightforward. Good, get your education, but afterwards we'll see if you even should practice medicine. So his thing was like, get an education.
Right.
And in fact, that was his whole discipline mentality. Being a tough Soviet father, he would say, you have to do good in school, everything else doesn't matter. You want to stay out late with your friends, as long as you answer your phone or your pager back in the day, you can go do it.
Do you guys remember those pagers?
Yeah. You want to have a girlfriend, do it, but you gotta do well in school.
Do well in school.
So if you did well in school, you got maximal freedom and personal responsibility. So I really applaud that mantra for him, because it set me up for success in working hard and making sure I'm set up in the best way to take on whatever venture I wanted to set my eyes on.
Let's go back, right? You want to become a doctor, knowing that to be a doctor, there's only a certain level of success that you can make, because you have all these, your father's a doctor, you probably know a few other doctors that are doing okay. How did you get into the social media world? Because being a doctor and social media are like completely different worlds.
Yeah.
Different parts of your brain actually have to work.
For sure. In fact, I would frequently, when talking to doctors, I would say, do you think it would be unprofessional for a doctor to be on social media? And the honest doctors, and I think most of them think this, but the honest ones raise their hand and say they think it's unprofessional. And at that moment, I explained to them that we, in fact, are all influencers.
How long ago was this? When you first started to like...
I started posting in college and in med school, kind of days in my life on Instagram, just sharing what it's like to be a student who is pre-med.
Right.
But then it really took another level, I would say 6-7 years ago, when I had a viral moment of popularity and I said, I want to show people the truth about healthcare and like really beat up misinformation.
Right.
So when I talk to these doctors who think social media and medicine don't go hand in hand, I explain that we actually are all influencers. So you're a dentist, you influence your patients to have a healthy mouth hygiene. You're a parent, you influence your children to live good lives. You're a teacher, you influence your students to do well. I'm a family medicine doctor, I influence my patients to have good lifestyle changes, to take their medications accordingly, etc. So we're all influencers. The fear that we've developed of being influencers comes from the fact that in the past, most people who were involved in media and medicine were scammers. They were snake oil salesmen, they were making miracle promises. And I said, why don't we just do what they do well, but then use it for evidence-based accurate medicine? And that was never really done before until we started doing it on YouTube. And most people thought that would fail. You have to sell out in order to get publicity and huge numbers. Well, now that we have almost 12 million subscribers on YouTube, 3 billion
crazy.
views,
It's crazy.
in the name of evidence-based medicine, I think it's safe to say the critics were wrong.
And not only were they wrong, I'm sure you had so many people that were doubting you.
Oh, sure.
Because I remember when I started even doing my social media, I've always had people talk behind my back saying like, why is this guy in social media? Why is he sharing dentistry related information or any type of information on social media? Like it was always frowned upon.
Yeah.
But nowadays I feel like there's so many future doctors that look up to you specifically, and they try to mimic exactly what you did. Yeah. But back in the day, it was like the biggest no-no. It was the biggest red flag to be on social media and this.
Yeah, it's because that snake oil style of medical media that existed, but also because it was viewed as very self-congratulatory, self-promoting behavior. And
very egotistical, you think?
Yeah, that's what people viewed it as. And now that there's been so many great examples, it's not just me, there's so many other great doctors on social media doing this, of people who are doing it responsibly, who are sharing good info. And then we realized the need with the pandemic of being able to challenge misinformation, of people saying things that are inaccurate. People are like, oh my God, we actually need medicine to be there. I
love how you just brought up misinformation.
Yeah.
What are some things on the top of your head that you would say it's mainstream now, but this is real misinformation?
Yeah, so what I think happens with the field of misinformation is in this very specific pattern. Where there's areas where science, modern science, accurate science, doesn't have clear answers, misinformation thrives. Because if a patient comes to me and I say I don't know, but then the snake oil salesman says, I know, and you just have to pay me $20 3 times, they're going to pay $20 3 times to try and get that answer. Because the easiest trust hack that you can do is act very confident. But we as doctors, we are very aware of what we don't know. So we're not going to act overly confident when we don't have the answers. And that's the honest way to practice medicine. You have to function in a field of uncertainty with the best possible evidence that you have.
With confidence as well. You need confidence, obviously.
Of course, but not overconfidence.
Not overconfident.
And not overpromising results. So the way that I see this thrive is, if we look at it historically, when I was growing up, the biggest thing that the misinformation people would prey on would be fat burners. It would be, do this fast, do this miracle lemon potion. Here's the pill that you need to take. Even some famous doctors on television were brought in front of Congress for some of the miracle weight loss products that they talked about. And it was a huge deal. Now we have an evidence-based pharmacological solution with Ozempic and all these other medications, GLP-1 agonists that are in the news, that are actually helping people to lose weight. Well, guess what? The misinformation folks have to find a new thing to talk about and sell. So what are they doing? Let's talk about anti-aging. Let's talk about how we can reverse aging.
Oh, yeah.
Well,
which is the hottest topic.
It's the hottest topic, and it's a great thing to research.
Right.
But they're not researching it. No, they're talking about it as if they have all the answers.
They have the solutions for it.
Yeah, and we don't. And the whole idea of anti-aging, I'm not with. There's aging well, or there's aging poorly.
Aging gracefully. And that's what I tell a lot of my patients. It's not about growing older. It's growing older gracefully.
Yeah.
And how do you do that? Because everyone thinks, because there's a couple of guys online talking about going backwards, like the what's that condition? The
Benjamin Button.
Benjamin Button. Everyone wants to look like they're 10 years younger,
Sure.
moving forward 10 years. But at the end of the day, in actual science and medicine and in dentistry, you want to age gracefully. You want it to look like you're growing older, but in a slow fashion.
When we're talking about anti-aging, why it's problematic in my head is that I want patients to, at the same time that they're learning a fact from me, learn how we get to those facts. And when you start saying that if you spend $1 million on this protocol, you're going to be able to live 10 years longer, or I can tell you exactly when you're going to die, that's not only telling them a lie, but it's also ruining how they go to understand the rest of medicine.
That's right.
And it fosters mistrust of doctors who say, I don't know. When in reality, if a doctor says, I don't know, they're not trying to slim your wallet. They're not trying to trick you.
Right.
They're actually admitting that knowledge has a limitation.
So, Dr. Mike, you're in great shape. You look young. What are some what are some things that people could do to age gracefully?
Yeah, aging gracefully is not available to everybody, first of all, because there are certain conditions that are completely out of our control. So whether or not we are 60 years old or 20 years old, we can't control that.
Correct.
So what I'm going to talk about are things that are within our control. Number one, we can control our body's movement. We can get our bodies moving. That means physical activity. And to make it simple, I say 150 minutes a week of moderate intensity exercise. That can go up and down depending on what you're trying to do. But really just about staying mobile, not sitting for too long, not laying down for too long, and just in general keeping a body in motion. Second is trying to follow a healthy diet. Now, if you Google healthy diet, all the BS that you're going to get out there is going to be very complicated. General feedback is trying to keep a healthy weight with the amount of calories you're consuming, and then focusing on getting your calories from whole foods. Fruits, vegetables, lean sources of protein. When we say lean sources of protein, we think chicken, fish, vegetarian sources of protein.
What about bison? I'm a big fan of bison.
Yeah, I personally like bison as a form of meat. I would encourage people to not overeat red meat. But for example, like I consume a bison tenderloin that has 0 grams of saturated fat in a 4-ounce serving and only like 1.5 grams of total fat.
Right.
So there are lean sources of even red meat. And when we're moving from there, we want to talk about sleep. That's another important pillar of health. Not just sleeping to the 7 to 9 hours a night that adults need, but sleeping the same 7 to 9 hours a night.
You mean consistency?
Yes. So the consistency in the number of hours and which hours. That's really important. And then the one that we probably don't talk about the most, our mental health.
Right.
And mental health, not just saying that we all need to really spend time meditating or doing something very prescriptive, just being mindful of the fact that our mental health has implications on our physical appearance, our physical performance. And when we do that, we then can trigger ourselves to take action, whether that means getting mental health support, spending time being mindful, journaling. All these things are very quite simple, but really go a long way in terms of helping your entire healthcare.
To jump on the mental health note, it's also about who you surround yourself with, right? So I have a friend like you, and I'm like, Mike, I'm going through a tough time. What do I do? You refer me to somebody who's a specialist. And just having conversations with a specialist could change your energy, your mood, your attitude, the way you feel about yourself and the way you react throughout the day. It's about finding a specialist that fits your needs.
Yeah, I mean, you're trying to find a person that is going to be educated enough to help you along the journey. What's interesting about mental health, though, is that it almost doesn't matter if the person is a psychologist, psychiatrist, social worker, counselor, friend. If you have the social support, it will help. So just the presence of that social support or having someone being there for you is going to go a long way. And what I've actually seen across all my patients, which is like thousands of patients that I've treated across my medical career, is that they think that when I'm sending them for a social work consultation or a psychologist, there's something inherently wrong with them.
Wrong with it, right?
And that doesn't always pan out to be true. Yes, you may have a diagnosis code for insurance purposes, but in reality, we as humans have flawed thinking, especially when it relates to current society that we live in. 1,000 years ago, we were in much more danger, so we needed to have our anxiety on high alert to be looking out for lions and bears and things on every side. Here, when we're in our safe apartments and our safer homes, obviously this doesn't apply to everybody, but the majority of us, we are much safer than we were. Now, how do we control this anxiety that kept us alive at one point, but is now acting as a hindrance? That's what those specialists that you're talking about help us with.
That's a great point. And what's that show on Netflix? There's a show on Netflix about how people in certain areas of the world, the blue zones, they live for like 100 years, or over 100 years.
Yeah.
And some of the biggest things is exactly what you pointed out: sense of community.
Yeah,
community was very important. Exercise, walking, planting.
All those things that we just talked about are shown in the blue zones, and I think the blue zones they're interesting to look at, but we don't use them to form evidence guidelines.
Right.
And I'll explain why. There exists something known as survivor bias. Have you heard of that?
No.
Okay, so survivor bias is basically when you look at outliers in a population and you assume what they did is the reason they got there.
It's going to work.
And we don't always know that to be the case. So you could use survivor bias in a positive way, like we actually saw during World War, where they would see the planes that would come back and they would have bullet holes in almost the same areas. And what did that tell them? That told them that the planes that came back and had bullet holes in the same areas, that means they can get shot there and it doesn't matter. But if they don't have bullet holes in these areas, we should put more armor there.
Right.
Because that means they're not coming back for a reason. And that actually worked quite well as a good example of survivor bias. But if we're looking at the opposite end of survivor bias, just think about how we talk about architecture. Oh, older buildings are so beautiful. They last so long. Modern stuff is garbage.
It all falls apart.
Yeah. Do you know why we're saying that? Because all the old buildings that were trash, and most of them were back then, have been demolished since, and only the outliers, most amazing, beautiful buildings have stood the test of time. And we think all the buildings back then were that way. But that's survivor bias.
Because you're my doctor and because I trust you so much. But for the general public, when we say sleep more or eat better, how do they track it? What's an amazing way for people to listen to this podcast and right away maybe purchase something or start doing something to start tracking their health?
This is why I'm a bad podcast guest. This is why I'm a bad earner on YouTube. I'm not a fan of tracking most things.
Okay.
And I'll explain why. There are certain times where I say, like, look, using, like, let's say MyFitnessPal or one of these calorie counting apps could be beneficial so you can learn approximately how many calories are in 6 ounces of meat or whatever it is. So for education play, it could be interesting. Also from like a fun play, if you're trying to gamify something, yeah, the Apple Watch and those fitness trackers, the Whoops could be interesting. But here's why I hate them. You come in and you say, hey, Dr. Mike, I've been sleeping 7 to 9 hours a night. How do I know if I'm getting good restful sleep?
Right.
Do you feel like you need to nap during the day? Do you wake up feeling terrible?
Let's say yes.
Do you fall asleep well?
Yes.
Well, those are questions I would ask.
Right.
If yes, then you're not getting good quality sleep.
Exactly.
It's that simple. We don't
Exactly.
need the fitness tracker.
I was saying yes just to kind of go with your flow.
But the point of why I'm saying this is here's where the fitness trackers and the sleep trackers and all that get me really amped up.
Right.
Let's say you're wearing a thing on your wrist and it's telling you you're getting bad sleep, but in reality you feel fine.
Right.
What are you supposed to do? You feel great.
Let me ask you that question. Don't ask me.
No, but that's the thing. Like, what do I do as a doctor?
Right.
If a patient comes in and says, I feel great and I wake up feeling restored, I don't need to nap, but this thing is telling me I get bad sleep.
Right.
What is my advice? Throw the thing away. Like it's not valuable. But if you wake up and you feel like most people will either have one of two situations happen.
Right.
The thing will say you get bad sleep,
right,
but you know you're getting bad sleep because you feel terrible when you wake up. So you didn't need the device to begin with. Or it's going to tell you got bad sleep when you feel great.
Right.
And you should still throw away the device then because it's not helping us in this situation.
So basically, you're saying that if the device will tell you you're getting bad sleep and you feel bad,
great. If you feel
bad, then you might
you already know. You don't need the device. But if the device is telling you sleep bad, but you feel great,
yeah,
It's going to make you feel bad because it's...
I mean, it's almost the same concept of like when a person has a little lesion in the mouth, they start Googling everything and it starts to give them that domino effect of certain things. I mean, everyone wants a quantify their health.
Sure. And look, more information isn't always better in healthcare because we're kind of in the stage of information overload where everyone's tracking everything and they're bringing it to my office and I have no idea what to do with it.
Right.
And maybe in the age of algorithms in the future, we might be able to parse through this data or in research do something valuable. But for the everyday person, I don't see a lot of value. Another important takeaway here is there's a lot of fear mongering that happens along these products where we've actually seen research where we can track patients' sleep and the patients that don't sleep well perform poorly on the cognitive test after. That makes sense. You don't sleep well, you perform worse. Right. But if they sleep well, and then we lie to them and say, we're doctors and we said you slept poorly, they perform worse. Right. So you could actually, the watch can be influencing you to perform worse when you're feeling great.
Yeah, I mean, listen, the watch could maybe tell you didn't sleep well, but there's so many like avenues why you might not be sleeping well, right? There's sleep apnea, there's other...
Yeah, but at the end of the day, you'll know. Yeah. That's the thing. Like what I feel like the watch acts as a barrier for you to learn about your own body in some ways. Like I want you to be more intuitive and know your body signals when you're having a pain. Is this a pain that's just an ache? Is this a sore pain? Or is this a dangerous injury?
Without something else telling you.
Right. Or is this, am I really just sleepy because I had a bad night's sleep or because there's something weighing on me from a mental health standpoint? I want you to be in tune with your body.
So basically you want people to be their best trackers.
Correct. But those watches in many instances, and people will give examples, counter examples, says, the watch helped me learn that I recover best. But it's always like things that I've been saying already for free without a tracker. People are like, oh, my Whoop score is terrible when I drink heavy at night. We've been saying don't drink heavy at night for ages. You didn't need the Whoop thing.
Okay, so you're talking about the trackers, but what about like blood tests? Because there's all these nutritionists. You had a bunch of these guys on your podcast and on your YouTube show and channel, and I love the way that you defend your stance on evidence-based because a lot of people are trying to sell these snake oil potions. What's the gentleman that was just on your...
Dr. Stephen Gundry.
Shout out Dr. Gundry. The conversation you had with him, the way that you battled evidence-based misinformation, it really puts things in perspective. So how important is blood tests?
Blood tests are very important. It's very individually dependent, very demographic dependent on what blood tests I'm ordering. I will say as a society, we're in a state of over-ordering tests.
Let's say someone goes into a doctor's office and the doctor just decides, let's do 30 of these tests versus...
Well, it's hard to say because in a situation it might be appropriate given the constellation of symptoms. I will say for like the average healthy person to be ordering 30 tests, I would be asking questions like, why do I need these tests? But in general, what I see happening is people start going to these executive health programs or concierge medical programs where they want to feel like they can buy good health by doing more scans, more blood tests will equal better healthcare. And this is the unique thing about healthcare. People on the low end of the healthcare spectrum, meaning they don't have access because of financial limitations, they get bad healthcare. Why? Because they can't afford the car to get to the doctor's office. They don't have insurance to get seen by the doctor. They can't afford their medications, so they get less quality care. But then the wealthiest also get bad care because they think it's Burger King, that they could just get more, and that's somehow
whatever they
keep them,
want.
and that would keep them healthier. But there's actually a syndrome known as VIP syndrome in healthcare, where
VIP syndrome.
Yeah, where like you think you're very important, and because of that, you're going to get more care. It can lead to downstream effects of not only getting care that you don't need, but also side effects that are sometimes lethal because you pressured your doctor because you're so important to write you prescriptions for things you don't need. Classic example of like, I have a sore throat and I want an antibiotic, when very clearly the doctor knows you don't need one, but you demand one, then you have a side effect from the antibiotic that you would have never had.
Or even like patients that have not done it, like a strep test. They don't know if it's a virus, and then I want antibiotic.
Yeah, exactly. The same scenario.
So like, but because they pressure the doctors. A lot of doctors are just, yes,
Oh, it's
yes,
a VIP?
yes.
Yes, I got to write you the prescription.
And it's not even for that virus. It's actually causing damage to their liver, their kidneys.
Well, it's creating risk.
Yeah.
And that risk is usually okay if the medicine was warranted because there's a benefit. But if you lose the benefit, the risk is just unwarranted.
So in dentistry, it's somewhat similar, right? So let's go into the regular dentistry. A person has a pain in the tooth right off the bat. They'll message me or they'll contact the office. I need antibiotics. Mm-hmm. What if it's just some gum recession? What if it's just a small cavity? Like, if we were the yes doctors, the antibiotics would be sent out to everybody. Or what if someone has like a little discomfort with the sensitivity? They want some narcotic to like cause their pain to kind of go away. I could see that becoming like a really bad ending for a lot of these doctors, a lot of the patients. So you're saying that being on the spectrum of VIP, I can see that happening. Mm-hmm. And then the really opposite side, those people are getting really poor quality work as well.
Yep.
So then what is the solution?
For a patient, I think it starts with creating a healthy relationship with a good primary care doctor. I feel the more young folks I speak to these days, the more they're treating urgent cares as their primary care, where if I have an issue, I'll go see a doctor. Otherwise, I'm good. Well, then you're not really establishing that long-term relationship that's going to prevent you from running into these issues. And then you never know which doctor's treating you because you're at the whim of whatever doctor's working in that urgent care.
Dr. Mike, you hit this so far over the fence. This is exactly what I tell my patients and people that reach out to me. Build a healthy relationship with your healthcare provider, whether it's a dentist, whether it's someone in medicine. At the end of the day, your history and someone knowing you for a long time can help better treat you than you going to urgent care, because urgent care will probably put you in a box and like there's 3 boxes, and then they'll be, based on your symptoms, you're going to get this.
Sure.
Versus a very, very customized approach.
When I hear customized approach, the thing that I'm thinking of is when you have a long-term relationship with a doctor, the biggest benefit is you learn the doctor's biases and the doctor learns yours. So for example, I have some patients that I know hate medications. So if I'm in a situation where I'm like, I can prescribe medicine here, but I could also not, I know that patient and I know what the best way to function with them is because I know their bias. I could also see how a patient knows that I have a bias to not overorder tests. So they may say, doctor, I know normally you don't order a test here, but I really need this for reasons X, Y, and Z. And they would know how to communicate better with me. Right. All of that creates a better teamwork approach so that we can get down to the bottom of it. Before it used to be the patient comes in, doctor, like a dad says, oh, you got to do this, this, and that. And if you don't listen to me, you're a bad patient. Or that's done.
Or you won't heal, or your symptoms are going to proceed and so forth.
It has to be a team-based approach.
And it's so funny, especially in dentistry. You go to 5 different dentists, you get 10 different answers and results. Sure. So one dentist could say you have 15 different cavities. Another dentist goes, you have nothing, we'll just monitor it. Another dentist goes, you might have to redo your whole mouth. Like, how do we create maybe a standard? How do people know what's the standard in medicine? Because in dentistry, it's like all over the place.
Well, the way we have standards is by having large organizations put out statements and guidance for young doctors in their training. But that is only one step of the healthcare puzzle, because you can have all the general guidelines you want, even for specific conditions. At the end of the day, those general guidelines have to be then tailored to the individual sitting in front of you. For example, we talk about controlling people's blood pressure to reduce the chance of them having a stroke or heart attack. It's very important to have your blood pressure in a good range.
Which is a very common thing as well.
Very common thing. A lot of people have elevated blood pressure. And just having one reading does not mean you have high blood pressure, hypertension. It means you have one reading of high blood pressure. It doesn't mean you have hypertension.
You could have had a stressful day. You could have eaten something.
So we would need multiple readings done correctly over multiple days.
Right.
But anyway, we prescribe medications to lower people's blood pressure. Now we do this, and there exists in statistics when we're talking about lowering people's blood pressure, NNT. Have you heard of this?
Say it again.
NNT.
No.
It's called number needed to treat.
Okay.
It's how many patients I need to treat with a specific medicine to have some kind of outcome. So how many patients do you think I need to treat with a blood pressure medicine to prevent one case of a heart attack and stroke? Like, how many patients, like if I give one patient a medicine, will I prevent a heart attack and stroke?
Not necessarily.
If I treat 5, do you think I would? Sounds like we're getting there, right?
Yeah.
No, it's like 80.
80.
Yeah.
Wow.
So yes, we've seen that by lowering someone's blood pressure to the correct reading from, like, let's say 140 to 120, we will lower the chance of them having a heart attack or stroke by, let's say, 30%. That's really good. But that's the general number. Now, on the individual level, I need to treat 80 patients to get that one heart attack result, because not everyone's having heart attacks.
Exactly.
So I need to treat 80 people. So when I see that, I know for my practice, I should generally get people to control their blood pressure well. But if I have one person who's like, I'm having weird side effects from this, I don't really like medicine, and if you force me to take this, it's going to hurt our relationship. Am I going to force that patient to take it?
Of course not.
Or I see that 99% of the time it's not going to do much for them.
Exactly.
I probably am not going to force it down their throat. And I also want to be cognizant of the fact that just because this one patient may not take it, it doesn't even mean they're doing anything wrong. They could hear all the information and based on what their risk tolerance is, not want to take it. And that's perfectly okay.
Fine too.
That's why I'm not their dad. I'm their team member, giving them the evidence, translating it to them, and they decide what's right for them.
That's because you're working as a collaboration with your clients. And that's what I do. Because at the end of the day, there's no wrong or right. I mean, to be a dad and saying, you have to do this, you have to do that, like, there's so much research out there right now that you guys should be doing your own research. You could actually come in with a lot of knowledge and your own research and come in and share that with your doctor. And
yeah, do you like when patients, like the doctor Google, when patients Google stuff and then bring it to you? Because some doctors hate it. So I'm curious how you think about it.
If the patients do quality research and they come in with quality research and they're open-minded to a conversation, I love that. But if they come in and saying, well, I was told, and this is how it's going to go, then that's the wrong approach to take it. And the same way, if your doctor comes in and goes, I was told and I was taught, and this is how you're going to go about it, you shouldn't do that. There needs to be a healthy collaboration, a healthy conversation, and only then can you really build something special together for longevity. Because ultimately, this is almost like a marriage.
Yep.
You really want to build a long-term relationship with your healthcare provider. I think that's the most important. This urgent care business, it sounds great. Like, oh, like you said, I have a sore throat. COVID is here. I think I have a stomachache virus. Let me go to urgent care. But what are you getting out of it?
Well, urgent care fills a need, and we shouldn't throw the baby with the bathwater.
What's the need? The need is for people to
Well, I'll explain
who
the
don't
need.
go routinely to doctors and
Well,
then only go when there's symptoms.
Well,
or like
that's how people are misusing urgent cares.
Okay.
But urgent cares have an appropriate use.
Yeah.
We don't want patients who have a sore throat clogging up the ER systems.
Okay, that's-
So urgent cares fill a need within the healthcare system. Even like, let's say, primary care doctors that see patients on their regular for physicals, et cetera, may have wait times of a few days, a week or two to get in. So if you're sick now, where do you go? ER?
Right.
You're going to be clogging up the ER, so you go to urgent care. That makes sense. But if that's your sole connection to the healthcare system, that's where it becomes problematic. And that's why I don't like when urgent care centers try and position themselves as the solution to everything, because it's not. Same thing with telemedicine. These for-profit companies will shove telemedicine down our throats and say, this solves everything. Well, no, it solves issues for patients that just need a follow-up to talk about a medication dose, a follow-up visit to talk about blood test results, maybe to see a sub specialist that is not available in a 500-mile area near them. But how am I going to do a physical exam on someone's abdominal pain through telemedicine? We have to understand they have uses, they're tools, and you could force and use them certain ways, but it's going to backfire.
Right.
The same way that if you want to hammer in a nail, you could use a screwdriver and try and jam it in, but you're going to hurt your hand doing it.
Exactly.
Just use a hammer. It's a better tool for the job.
People are misusing
A tool of urgent care.
tools of urgent care.
And the for-profit companies are really happy about it.
Oh my God, they're so happy.
Well, because a lot of it is private equity money, and they're trying to maximize profits and forgetting about the fact that this is healthcare that is literally costing people lives, and they're not thinking about that. That's not their sole responsibility.
Here's another question. I'll say it out loud right now. So about a couple months ago, right before New Year's, I had like the worst body aches, pains, and so forth. Then 3 weeks after that, I developed some type of stomach virus. What is going around?
There's a lot of viruses.
By the way, for those that are listening, we're in New York City.
Yep.
It's a jam-packed city.
Yeah.
There's a lot of bacteria, viruses, all that.
Yeah, so what happens...
What's going on?
Yeah, in the wintertime, it's unique because the air is drier, so germs have longer hang time. So when someone walks into a room and they sneeze, if it's humid, those germs fall. But if it's dry, those germs tend to hang in the room. So basically, someone could have walked into an empty room and still get sick just because someone sneezed in it like 20 minutes ago.
Like an elevator too?
The elevators everywhere. So what happens in the winter? You have this dry air, so germs have longer hang time.
Right.
You also have people going inside because it's cold outside. So they're closely packed together. So more spread of communicable diseases that way. And then also because it's cold and dry, our mucous membranes dry out, our noses dry out, our lips crack. And that's another way viruses enter our body. So if you think about all these things culminating together, you get a lot of viruses. And every season, there's different viruses that circulate.
Are you noticing more viruses now? Like different viruses, like
there's always different viruses
Okay.
every season. In fact, the way we make the flu shot, which helps decrease hospitalizations, deaths from the flu every single year, we try and guess what are going to be the predominant flu strains based on what's happening in the southern hemisphere in the world. So we look at that, we see how can we change it and predict what's happening here.
Right.
And based on our guess is how good our results are with the flu shot. And even when it's not great, like let's say it's 30 or 40% effective at preventing the flu, that's still great because that's saving millions of sicknesses and hospitalizations, but it's also saving thousands of lives from those hospitalizations, especially those who are high risk, elderly, young kids, those with immunocompromised states, or they're taking medications that make them immunocompromised.
So dentistry is something that people go through from an early age, and you're one of those people that you've had different dentists throughout your whole life.
Yep.
But building a dental home is just as important as building a medical home, a doctor home, and building a relationship. Obviously, I got you.
Yeah, for sure. And that's like similarly when I was in residency training, I remember a construction worker came in with a big scar just over his eye. And I was like, hey, man, I could suture this, like no problem. But the scar won't be as pretty unless I get a plastic surgeon to come in and do it. And he was honest about it. He's like, I couldn't care. I like scar. You do it.
You do it.
So I did it perfectly and it was great. And maybe he has a scar, but like it's what your intended use is.
Exactly.
And for me, you know, being on camera, seeing my face all the time, and I wanted to have the best results, so I went to the best person.
I appreciate it.
In terms of my face changing, do you think that has anything to do with the performance of my teeth, breathing? Like, what impact does that have on the human body?
So a big thing that I've noticed, obviously, throughout the years is that you also have a tough time breathing through your nose.
Mm-hmm.
So,
I get punched in the face from boxing, you know.
and we're gonna get into that as well. This guy's a professional getting punched. No, you punch people in the face.
True.
Do you have a hard time breathing through your nose?
Yeah, of course.
So what happens is, for those people that have a hard time breathing through the nose, what happens? Where do you breathe from?
Ears. Oh, is that not how it works?
Yes.
Sorry. Mouth, yeah.
Yeah, so you breathe through your mouth. So here's a couple of things that could happen if you breathe through your mouth. If you're younger and you're having you have a deviated septum and you're breathing through your mouth, now your whole jaw development is going to change. That's A. So your facial structures will be different than what it's supposed to be. The palate could change, the jaw formation could change, and things like that. Second thing is, when someone is a mouth breather, and this is something very, very important for many of you guys, a lot of people have gum problems. A lot of people. Not because
I have gum problems.
But not
you
because
can just point at me.
Not because you don't take care of it or so forth. If you're a mouth breather, you dry out your oral mucosa. When your mouth is dry, it's the premium time for bacteria to thrive and for gingivitis to kick in. And mouth breathing is one of those causes for gingivitis. Are we going to get a plastic surgeon to help you?
Yeah, with my nose now. Yeah, exactly. Only to have it rebroken not too long ago. But I do have a question about mouths changing size.
Yes.
Like, is it true that when back in the day, or why now everyone's having to extract their molars, is it because we're not chewing hard foods? Is there any truth to that?
There is some truth to it. So depending on your diet. So like, I guess when we evolved with thumbs, and then we started using the thumbs, and then everyone started to have thumbs, and we started to develop
It was a survival advantage.
Survival advantage. So now we're eating a lot of like processed foods. We're eating foods that don't require so much of the chewing. Because back in the day, we used to eat raw meat, plants. We used to need to chew everything.
Mm-hmm.
And if you looked at the teeth from people from back in the day, they have very flat teeth because every single tooth was being used to grind down the food. Now I feel like everything is already pre-processed for you.
So should I borrow Bear's Chew Toy and just sometimes...
No.
Or you don't recommend it?
I do not recommend it.
What about those jaw trainers? I've spoken negatively about them from like a TMJ perspective.
Yes.
But have you seen patients come in that say, oh, I've been trying to get Ronaldo's jawline with this thing? And have you seen that?
Ronaldo's jawline is Ronaldo's jawline. And I think people need to understand that. Like, it's an incredible thing to appreciate someone's physique. But if you're genetically not blessed with that, there are some problems that could occur if you start to use methods to try to increase that jawline. So that, what is it, that ball method? What is that? The chewing.
Well, yeah, they have like those things that you could chew that are increased
Exactly.
in density and all that.
So those methods that are there to help you create
Develop
a masseter muscle to be wider and bigger, what happens is now you're putting a lot more strain on your TMJ, and you're 100% correct. When you put strain on your TMJ, you start developing neck pains, headaches. You could start snoring more. You could start grinding your teeth more. There's a detrimental damage that could happen. I've had patients who naturally have these massive masseters because they just grind and clench. If you're one of those people that clench and grind, just bite down and touch the muscles of your face and see if it expands and how much it expands. So you don't need your muscles to be tough and strong there. You need your arms, your legs muscles to be stronger. Your facial muscles do not have to be that big. And a lot of my patients, I recommend some Botox in their muscle, in their masseter muscle. Slims down their face, and now they're like, wait a minute, I don't have those symptoms of headaches and neck pains because they're not, their muscles are not being used to that extent.
Well, it's the whole myth of spot reduction, right? Some people are like, oh, if I just do a bunch of sit-ups, I'm going to get a six-pack. Well, it's like, no, you have to lower your entire body's fat content before you start seeing the muscles that you're developing by doing the sit-ups. So like spot reduction is just not true.
So yeah, so a lot of these trends, whether it's in the dental, like the head and neck area, or the rest of the body, keep an eye out on these trends, because these trends could actually cause a lot of damage to your body. Like these little potions that could help you lose weight, or these potions that could help you reverse aging, or have a better facial structure. They could cause damage that's a lot more than just whatever you think short term. So this is a little controversial. How many videos have you done on YouTube already?
Including shorts, getting close to 1,000 videos.
First off, like, trying to come up with content for 1,000 videos.
That's evidence-based.
And that's evidence-based and not just like hocus pocus. I applaud you for that, because I myself try to do some content and it's so difficult. And you have to stay on this fine line of evidence-based and what's right and wrong. And you can't just share whatever misinformation you want. But has there been a video that almost got you canceled and then it turned out to be correct?
Yeah. The thing that I've been accused of in the past, especially when making content surrounding weight loss, has been very controversial. In fact, at one point I was labeled on Reddit as being fat phobic because I talk about things related to weight loss, bariatric surgery, now Ozempic, and there is a reason why people have a very strong sensitivity to this. One is because society generally mistreats people who are overweight, whether that's fair or unfair. I mean, it's really just unfair, but the fact that they then take that and then label me fat phobic because of their past experiences, that's where we could talk about whether it's fair or not. But the reason why I still think all the videos that I made have been factually accurate and important for people to see is because it's not my job to judge people. My job is to present evidence. So if my evidence shows that it's not healthy to carry extra weight, and evidence shows that it actually shortens your lifespan, and most importantly, ruins your quality of life as you age, I'm going to talk about that. And I could talk about it more responsibly. I could use better vocabulary when I do, and that's what I've learned from the situation. But the fact that I still need to talk about weight loss and the importance that extra weight has on knee pain, back pain, headaches, cancer development, breathing, all of these. I just had a patient the other day that she's gained a significant amount of weight where actually she's developing something known as atelectasis in her lower lungs, where actually the air sacs are essentially dying off because she can't take as deep breaths. So these aren't imaginary situations. This is reality. And unless we talk about them in a non-judgmental way, we won't be able to help people. And look, the thing that's interesting about science, and people will knock us for this and the whole notion of what I said earlier, that we say, I don't know a lot, is that, they'll point out, oh, doctors used to say this, and they used to say that coffee is bad for you, causes cancer. Now they're saying it prolongs life and all this stuff. And the important point is that we're constantly updating our knowledge. That's what a true doctor does. And like Fauci was knocked for this throughout the pandemic. Like, oh, he changed his stance on this. Well, if evidence points to a different direction, a large amount of good quality evidence, you have to change your mind. Like when we say follow the science, we don't mean follow the scientist. We follow what evidence has shown us.
The research that from the population at hand.
Exactly. So we try and do our best in creating good research articles, and not all of them carry equal weight in terms of what grade level the evidence they are. But that's what we do in science. So of course, what we're going to say now is going to be different, 100 years from now. In fact, I know that when we look back, number of decades from now, 50% of the things we're doing now are going to be looked upon as ridiculous.
Right.
And kids are going to be like, wait, you used to put cameras in your butt to see tumors? When 50 yeyears from now, we're going to have advanced imaging that where we don't need to do that anymore. And that's considered barbaric.
Maybe like a scan, like a light scan or something. Where
there's who knows what's going to come up, but that's the reality of medicine. And until we can help people understand that's how evidence works, we say, I don't know. We pose questions. We test those theories. We refine them over and over again. And we change our guidance based on the information and the best quality of information we have at the moment.
Amen. So for those that have to hear this again, to find a doctor, not only that cares about you, not only that you have a great relationship, but a doctor that is able to evolve with the information in the times. Because I know that, I remember I used to shadow some older dentists, and they have their ways, and they're stuck with their ways from research that was done from 100 years ago.
You have to update your knowledge.
Even like the simple things like the metal fillings. I've had people come to me with these metal fillings placed recently, in 2013, 2000, whatever.
Are metal fillings bad? Why?
It has mercury. They expand. Like there's so many. It's not even metal. It's just like an alloy of different chemicals, ingredients in there, and it was a cheap material that was invented to fill in the holes created by cavities. But anyways, that's old research. Now there's ceramics that doesn't expand, that looks cosmetically better, and so forth. So you need to find a doctor and a dentist that evolves with the times. So, like, for instance, you're talking about my office. All these technologies are very expensive, but purchasing these technologies will help evolve the process. Like, now we scan the mouth instead of taking impressions. Like, there's so many different ways that you could become a better practitioner, a better healthcare provider. It's you understanding research, evolving with technology, and being open-minded.
Yeah. And now, I would caution people away from those who are overconfident in their knowledge. I'm sure you even know, there's people that we know that they'll come to me in front of you and ask me and say, Mike, I have stomach pain. What do I do? I don't give them an answer.
Of course.
I say, I got to ask you 10,000 questions before I can even begin to maybe give you 10 conditions it could be and 100 tests we need to do beforehand. And then I'll give you a list of treatments that you could choose from based on what you think you'd like to do for yourself. So that's how complicated it is. But you got to admit that there's a lot of naturopath people and all these homeopathy folks that are like, oh, you have stomach pain? Here's a root.
Take this.
That's why.
Yeah.
Or how many videos do we see from Gary Brecka, who's Dana White's, he's not his doctor, so I don't know what he is, advisor, scientific advisor.
Is he the 10X guy? Or?
Yeah, and he's like, if you have headaches, it's because you're not getting pink Himalayan sea salt. My guy, what if they just had a concussion and you're feeding them salt?
Exactly.
What if they have hypertension that's going to cause them to have a stroke and they're bleeding out in their brain, you're feeding them salt? That's the sign, the clearest sign that overconfidence that this person is not a good healthcare
Everyone
practitioner.
wants instant gratification. Like, I have a headache. I'm like, yo, just give me something. Give me something to get me out of this. You have a toothache. Give me something. I'm bleeding here. Give me something.
But that's not to say that doctors shouldn't treat symptoms. In some conditions, I might say, look,
let's take care of the acute problem.
Nothing that I can give you here is going to shorten the duration of your illness or make you solve whatever is going on. But if the symptom is really destroying your quality of life, here's some medication for the symptom. So we absolutely can do that too, but I'm not going to promise you a miracle solution when I am very confident in my own lack of knowledge.
Right.
Get a doctor that's confident in their lack of knowledge. That's a good way to put it.
I love that, because I'll have patients come to me and say, Doc, why can't you do the root canal? Or why can't you do something? Or it's not because I don't want to. It's because I know my limitations.
Yeah.
I know how far I could go with what I need. If I don't have the answers, I run it by the top professionals that I have on my team. You need to have a doctor that is willing to take a step back and look at things from a different perspective. So, we're still in January 2024. Happy New Year's. And what are some of the bigger goals coming up for you? Because, you're a media house, a powerhouse. You're a doctor. We'll get into the professional athlete. We play basketball, but you're a professional boxer. What the hell? But what are some of the bigger goals this year? And then we'll get into...
Well, the goal and the question I most commonly get from folks is like, are you going to stop practicing medicine, or do you even still practice
By the way,
medicine?
I remember you told me this many times, that people don't even know that you actually practice medicine.
Yeah,
that you work your ass off at a hospital.
Yeah, it's my 10-year anniversary of working at the hospital.
No way. Happy 10 years.
Thank you. The reason why I still work as a doctor is purely out of passion and wanting to change the field and making sure patients get the best care. And part of me delivering the best care means I get to set how much time I want with the patient. So I don't have a quota of patients that I need to see. In fact, like, folks get really mad when they're like, what do you mean police officers have a quota of how many tickets they have to write? That's so messed up. Well, yeah, get mad at that, but get furious that doctors have quotas of how many patients they have to see.
Exactly.
Irrespective of how serious their complaint is.
Yes.
So like, that's more ridiculous to me. And I'm lucky enough that I don't have to do that. I have to just make sure that I'm doing the best job for each individual patient. And I'll never give that up. I always want to practice medicine. I've been practicing for the last 10 years, and I'm going to continue to do that, even though that's not where my financial stuff comes from, where I'm very fortunate to have the financial success from social media. And from that, I'm able to give back by practicing medicine in my community health center, be there for my patients, and that's never going to change. But am I going to invest heavily into the media space and continue to grow that? Absolutely, because I think people are not just hungry for more accurate information to live a better and healthier life. It's my duty to give them the best information. Like family medicine doctors, what's special about my field is that when a patient sees us in an office, we're there. When they get sick and they're in the ER, we're there. When they're inpatient, we're there. When we need to deliver their baby, we're there. When they're in the nursing home, we go there. When they need a home visit, we go there. Now they're online. I got to be there.
You got to be there. So for those that don't know, what's a family practitioner?
So a family medicine doc is one that takes care of all age ranges. So like, if you're 1 day old or 100 years old, I can take care of you. Female health, we take care of. I still do pap smears in my office to make sure that we're checking for cervical cancer. I am trained to deliver babies, although that's not what I do as an attending anymore, given my time constraints.
But recently, you mentioned that there's a mom that showed you a picture.
Oh, yeah. Yeah, there was, on Instagram, ironically, there was a picture that I took, well, I didn't take it. The mother took it and posted it on social media of me with a baby that I delivered. And now that baby is like doing cheer competitions. And it's like so exciting to see the fact that I participated in the healthcare of delivering that baby. So it's truly, I think, the best field where you get to see a macro view of healthcare, because you're learning about all these different conditions and you need to be an expert of triaging it all, but also micro, because you get to learn about your individual patient. And then from a continuity aspect, learn about them from their entire life.
And you get to follow through on the choices that you make with your patient.
Exactly.
So let's say you go, listen, based on these symptoms, I recommend this, and then see how the outcome is, and then see if it's a fluke or if they come back with the same issue 5 years down the road. I think family medicine is the foundation, the bread and butter for healthcare, because it's not just like you go to a surgeon, they want to cut. You go to or whatever, an orthodontist, they want to straighten. So a family doctor has no biasness.
We're flexible.
So it's your 10-year anniversary coming up. What has been the most surprising lesson you learned, or something about the body you were like, I had no freaking clue that this is even possible?
Well, what I noticed in working in my hospital for the first 3 years of my residency was that so many patients that come in with physical pain, their elbow hurts, their low back hurts, they get headaches or neck pain, the cause is not always physical. And that's weird to hear, not only from people listening to this conversation, but also as a patient. So something that I started talking to about my patients after we rule out physical issues, anatomical issues, perhaps with imaging or physical tests, special tests, is talking about their mental health and talking about how their mental health impacts pain and their perception of pain. Wow. And what most people haven't been taught, because we haven't done a good job teaching this as a society, is that we actually have this remote control of volume that we can control of our pain. So in the same way that if you enter a dark room and someone whispers, it might make you jump, right? Because you're on edge.
Right.
So you turned up your sensitivity, right? The volume.
Correct.
Even though they said it quietly, you still jumped, right? Because your sensitivity was way up. So you could have the same pain in one part of your body, but it could hurt a lot more if your sensitivity's up. When is your sensitivity up? When you're anxious, when you're depressed, when you're in a fight or flight state. Those are people who are chronically stressed over a long period of time.
When you're going through a tough time in your life, right? When you go through
the sensitivity's up.
Your sensitivity, everything is a bothersome. Everything is a nuisance.
Yep.
So,
And there's patterns in this where like patients come in and they say,
Wow.
well, my back really hurts. And I'm like, well, which days of the week? They're like, Monday through Thursday. I'm like, well, what happens Friday to Sunday? They're like, I don't know. Well, I don't work on Friday to Sunday. Maybe that's why. I'm like, does your pain hurt when you're with your friends? No, never actually. Well, what happens? The tear in your muscle goes away?
Exactly.
Well, no, it's because of something is going on. And when we tackle those issues, it doesn't mean it fully solves it, but it definitely allows them to have better control of that sensitivity remote.
So you talk about your patients that go through a tough time, and then their mental gets into the physical. I know that you do so much between the charity and being a doctor and media, and the stress levels are so high. What do you do to maybe calm yourself down? What do you do to battle, I don't want to say depression, but I'm saying like moments of like those moments?
Yeah, well, I try and keep myself as busy as possible because that works well for me. When I'm passionate about something and I'm excited about it, that keeps me healthy. When I'm in a really down place, I do end up finding new ways to distract myself, and actually staying really busy is a form of distraction. Mm-hmm. So if something goes poorly in the hospital, I focus on the social media side. If something goes poorly, my views aren't great, or something's going on there, I focus on the hospital side. So having those distractions actually works quite well for me. And then sometimes I call my dentist to chat and talk about my life, and that helps a lot.
And vice versa, because there's so much.
You being my dentist.
Yeah, and you being my doctor. So when do you decide that distraction and having conversations with me and doing these other methods is enough? Or when do you start seeking professional help?
I have, first of all, worked with a therapist and have needed to, because I reached a point where I was like, I cannot function optimally, and things in my life started getting impacted outside of the situation that was going on. Meaning, like, if something happened at work, things would go bad at work and you would figure it out there.
Right.
But once it starts spilling over into other life activities where you can't hold relationships, you can't have happiness, you can't sleep well, and that goes on for a longer period of time, that's when you generally need help. But the answer is, if you're considering it,
right,
that's the threshold. Because if you're considering it, you should go.
Like, for instance, if you're like, wait a minute, it's still in my mind, it's not getting better, that's when you should start pushing.
If you're asking yourself the question, should I go get, the answer is yes. Because that means you've already reached this. Because the worst thing that happens is you go and that they say like you're good, or you get enough and you're fine.
Yeah.
But if you're thinking about it, it applies to the same thing for physical stuff. People are like, when should I go see a doctor about my shoulder? Well, are you thinking about it? Yes, then go.
Like, exactly.
Because you can't really know otherwise.
You hit the nail on the head. Like, people go, when should I go? If my tooth hurts, when should I go? Like, go as soon as you feel like it. I'd rather you be safe than sorry. Mm-hmm. And also, I remember when I first met you, you mentioned something that happened to you many years ago, and you turned to boxing as a way to cope, as a way to not only distract, but kind of allow your body to go through that.
Yeah, for sure.
So can you tell us what happened?
Yeah,
and like how you got into it?
Yeah, when I was in medical school, at that time my mom was battling cancer for a couple of years, but unfortunately during the first year of medical school she lost her life. It was a very dark moment for me and my father and my sister, and actually I ended up moving back in with my dad and staying with him for the rest of the year. So it was tough. I was commuting 2 hours each way to school to make that happen, and medical school is hard enough as it is, time commitment wise.
So tough.
So very hard, and I found myself getting really unhealthy, being really bogged down with mental health issues, with helping my dad focus and feel well. There was a lot of stuff going on. And I felt like I needed to branch out and do something new, learn a new skill, learn a new craft, find a way of healthy coping.
Yeah. And
I said, you know what, let me go on Groupon and find like a boxing class. And I found this boxing class and I went, and I fell in love with the sport. It was a healthy outlet, physical outlet for me, where I could help my health, but also help my mental clarity in those moments. And it became a big passion of mine, so much so that, as you're aware, I had 2 boxing matches a year and a half ago, and that was an amazing opportunity to have that. So that can only happen if you're trying to put yourself out there.
The fact that you turn your kind of coping mechanism into a passion, which then turned into a profession. When I mean profession, I'm not even talking about financially. You took it upon yourself to become an athlete, train like an athlete. And I remember I was so freaking proud of you. Your first fight in front of like 16,000 people. Guys, 16,000 people.
It was 10,000, but I appreciate that.
They were so loud. There was two guys yelling at me. I thought it was like 30,000 people. But anyways, it's a full stadium. It was in Tampa. And you won that fight. And you dominated. And the first thing you said was you dedicate this to your father and mother, which is a fucking unbelievable thing. And you should be so proud of yourself, because so many people try. And Dr. Mike, let me tell you, you do.
As much as I want to take credit here, I think we have to do the survivor bias thing.
Okay.
Just because I did it, there's a lot of luck involved here, and you can't quantify luck.
Yeah.
I'm lucky enough to have a supportive father who, despite losing my mom, was still there for me.
Yeah.
Who set me with his disciplinarian skills to do really well in school. I was lucky enough that my parents, despite growing up as immigrants, were able to secure a great future for me, give me financial security in order to set out and face my dreams. I was lucky enough to be healthy enough and physically fit enough to go do all these things. So there's a lot of luck here involved.
Right.
But there is also truth in the statement of luck favors the prepared. And the more you can work and discipline yourself and do these things, the more control you give yourself. Life, you cannot control to 100%. It's just physically impossible. Anyone that tells you that is a lie. But what you can control are certain factors, and you should do everything in your power without harming yourself to control those things. And I feel like I've tried my best to always balance those two thoughts in my mind. But I appreciate you bumping me down up to 16,000 people watching the fight.
I think, you and I being men and this macho-ness, I think the lesson is, if you're feeling stuck, it's okay to ask for help. It's okay to search for help. It's okay to speak to people, because at the end of the day, we live life once. And the better quality life we live, the happier you're going to be. So whether it's, seeking out for mental health or physical health or anything like that, it's better to look into that earlier rather than later. It's better to be proactive than retroactive. It's better to prevent disease, prevent all these things. I mean, you can't prevent everything, but try to be as preventative as possible than trying to cure problems.
Yeah, again, the more prepared you can be for when things happen, the better off you're going to be. And also, there's a psychological benefit to empowering yourself to seek help. That social support will help. It'll make you feel proactive. A lot of people think they need to get motivated in order to do something,
right?
When that's not the truth. Once you do something, you will then get motivated. So the action has to precede the motivation.
That's right.
And not wait for the motivation to happen. And I feel like if we as guys want to live healthy lives and we want to be strong and powerful, that sometimes means taking the action of going to see your doctor, making sure you're doing everything within your power, but also not overdoing it at the same time, as we talked about earlier.
Do you see yourself fighting again in the future?
Yeah, for sure. I really want to do that again. It's hard to find an opponent given my size, my experience, and the whole influencer boxing scene has sort of changed over the last couple of years, in the sense of some have gone full blown like Jake Paul and are now professional boxers with a ranking and are fighting legit people. And then there's others that have fallen off completely and are not training and are not seeing the benefit in it. But if I get the opportunity again and there's an opponent, I'm very much down to do it again.
I think you almost had an opportunity. I know you had an opportunity, and it was so close for it to be an MSG.
Yeah.
I think if that opportunity happens, in New York City, and the fact that you're not afraid to try.
Well, I am afraid to try. I think that's also like the fake thing that I was like, oh, I'm so tough. I'm afraid of everything. Like when I get on stage, I'm nervous. When I'm boxing, I'm scared. Like the day before the fight, I was like shivering. When I was day of the fight, I remember my brother Alex came to visit me in my room, and I was like, I don't belong here. Like these are professional fighters with 30 fights, and I was doubting myself.
Right.
And these are just normal things that are going to happen. The same way that I said earlier that we're all prone to irrational thoughts and disordered thinking that lead us to need help from a social worker or a psychologist. We need sports psychologists. We need a friend to be there and support us. It's like all of it just is part of the human condition. And the more we can normalize it in that way, the better it is. I don't want to try and force to end the stigma by saying everyone has to talk about all their mental health conditions, all the medications they're taking, because that also puts pressure on people. But the idea of that if someone's seeking help, that's a positive thing. If we can get there, that's already a good step.
So speaking about influence, there's so many people, students that look up to you.
Yep.
What piece of advice would you give them? Like right now, they're in residency or even pre-med. Forget about residency. You're in pre-med and you've been watching Dr. Mike's YouTube channel for years.
Well, then they have all the answers.
Then you have all the answers. So actually, we did an episode, Dr. Mike and I did an episode on his channel about going to dental school versus medical school. I think it was such a great episode for people to really learn kind of like the foundation of what it's like to either be a dentist or a doctor. I know there's different stigmas for both. So if you guys go on his YouTube channel, you just search and you'll be able to find it. But what's something that you could share some wisdom for the pre-medical students or the medical students or any of those students that look up to you?
I think the two pieces of advice that are crucial that like I sort of focused on, but I wish I put more of an emphasis on, is step one, whatever question you want to ask me, ask yourself first, do you know yourself? So you want to settle down with somebody? Do you know yourself well enough to know that you actually want this person? Do you want to be a neurologist or family medicine doctor? Ask yourself that question. How well do you know yourself? Do you want to do those things? Do you enjoy doing those things? You have to know yourself. Do you want to pursue a new hobby? Know yourself first. And how do you know yourself? You put yourself into new situations, uncomfortable situations, not dangerous ones, but uncomfortable ones where you challenge yourself and then you find out what you like. I've done certain things that I'm like, oh, you know, that's not for me. Like I've done the show and the tour that you've seen me do.
Sure.
And while I like doing that occasionally, I know that's not what I want to do full time. I have done the social media thing and the doctor thing, and I realized the best way to do is to do both of them because I've learned that I know myself in those scenarios. So the first question is always know thyself, or the first statement is know thyself.
Right.
If you know yourself, you're going to make a better decision. And the second thing is medical training, all training these days is really long. There's a lot of tests, especially if you're talking about day one starting. So don't think about that, because if you think about that, it's so overwhelming. There's no way that you would even be excited to start. Instead, think about the single barrier you have in front of you at the moment. So for me today, that might be, oh, tonight I need to get home and get to sleep so I wake up feeling refreshed tomorrow. Or it could be, I have a single test tomorrow.
Right.
But if you start saying, I have a test tomorrow, I have a new thing in a month, I have the boards in this other month, and then the licensing exam, and all of a sudden, you're anxious, and now it's preventing you from living in the moment and succeeding in the moment. So only think about the next struggle in a given time.
What if, like, let's say I'm a student, I'm listening to this, but I'm like, oh, I just got like a 60 on my test. What type of motivation can we give them? Because I have one piece, but I want you to go first.
Let's go back to the two rules. Yeah. One, know yourself. Are you capable of doing better on the test? Did you short your studying? Did you do something that distracted you? Is this something you want to do? Is this something you're choosing to do? Now that's the know yourself component. The next component is, instead of thinking about the challenge that's going to be, 10 tests down or the one test before, what's the next challenge? How do you do better on the next test? That's what I want you thinking about. So those two rules will apply in all these scenarios.
100%. I remember the first ever quiz that I took in dental school. It was a computerized quiz, and it was the first time I ever took a computerized quiz. Back in my day, in our age, we took Scantron. I had to fill it in with the pencil. For those that don't know what a pencil is, it's made out of lead. So I would have to use a Scantron to fill in those bubbles, and then I'll give it to the professor. But here was a computerized.
What about the number two pencil?
Number two pencil.
And that has nothing to do with going to the bathroom.
No, not like it's in the bathroom. So
sorry, that was a Dr. joke.
Yeah, it was our first quiz. I studied so hard, and then I'm not used to the computerized tests. I'm not very tech savvy. Definitely not. My youngest brother definitely put me in that position. The first question I go, what? I think I know the answer, but let me go next. I press next on the first 3-4 questions, only 10 questions. I realized you're not allowed to go back. So I'm starting off now, question 5, not answered the first 5 questions, and I can't go back. So I'm starting with a 50. So I ended up getting a 50. Mm-hmm. And then there were people in my class who got like 70s and 80s, and they're like, oh my God, my career is over. I got a 50. So, but like you said, know thyself. I knew that obviously if I hit those questions and I didn't skip it and so forth, just understand that now one test A will make or break you. That's period. That's the number one thing. And B, you could always do better on the next test.
Yeah, and while we're giving all this advice and how to move forward and all that, you're also allowed to be sad that that happened. Like you don't have to create pathology around being sad when sad things happen.
No, that's true.
There's a lot of kids that come to my office and they're like, I'm depressed. I have a disease. I have a disorder. And I'm like, well, what's going on? They're like, well, my friend just died. He had a really bad disease and I'm sad. I'm like, well, that's not depression. You're sad because someone died. That's grief.
Happened.
That's normal. Or you just got a 50 on a test because something went wrong. You're allowed to be sad. This is not a medical disorder. This is normal life occurrences. And look, you may need help dealing with the sadness, but it doesn't mean you have pathology.
Here we go, at the top of the class on a roll, and it's time to run it up, yeah, you know, maxed out.